Hello everyone, my name is Dr. Scott Lamp. I represent the Roselle Center for Healing, and we're going to talk about tonight is alternative care for knee and hip injuries. And this is something that hits a lot of us, and I think it's very important that these areas of the body work well, because if you want to look at getting into our golden years and be able to walk and be able to live and breathe in the way you're supposed to, and have a long, at least reasonably healthy life, these areas of the body play a major portion, because if you start going downhill, you get into a wheelchair, you get into a walker, from past injuries that might possibly happen, it seems to accelerate our aging. Some stats on hips, 300,000 plus, and that number is only growing. The second part here you can see accounts for 95% from patients 20, 45 and older. Most common theory on this is generally osteoarthritis. With knees, we have a little bit more, 700,000 knee replacements annually, some for even little pain, over a million arthroscopic procedures. Average cost of the replacements are about $50,000 for a hip or a knee. And what's interesting is a growing number of younger people undergoing knee replacement surgery is something of a mystery. An international panel from the surgeons recommends for knee replacement were not correlated with pain, disability, or radiographic severity. I think anytime you're looking at getting a knee replacement, we're looking at long-standing pain at night, pain with weight bearing, and unbearable severe pain, and that should be the time that you're looking at that. Usually, a lot of times when you're dealing with arthritis, or a lot of times a knee replacement, you start losing a lot of range of motion in the knee, especially in the flexion of the knee. As always, when we do these health programs, we're always going to look at the biochemistry of the body. We want to look at the emotional aspects of the body. We look at the structural aspect, and even sometimes in the middle, we also kind of look at the genetics that can play a part, especially knees, hip dysplasias, congenital things at birth. That could possibly play a part. And usually when I do a talk like this or other talks, I talk about blue zones. This is where people have the highest quality of life without medications. They're generally live long lives, useful in their society. The highest level of blue zones would be, you're actually referring to the number of ratios 100-year-olds. We have Loma Linda, California, the Seventh Adventists out of California, Costa Rica, Italy, Greece, and Japan are some of the areas that have some of the longest living people. The thing is that they actually all have something very similar in common. They actually move, and they keep their joints well lubricated, and they have good ranges of motion in what they do. It's an interesting thing when you especially take a look in Asia and how the American tourist trade there is that to have American toilets there, because there's usually a hole in the ground when you have to go down to defecate. You got to go down a little bit farther, and the people can't do it because of their limitation in their hip or knees. Here's some of the reasons for their success. There's a lot of overlaps. They move naturally. Some are walking, some are gardening, some are doing Tai Chi, some are shepherding, some of those things. They have a sense of purpose. They know how to downshift. Plant slant means they're eating a plant-based diet, and also they probably have some omega-3 more, and the protein base is more fish. Family first, sense of belonging, right tribe. Why I'm at 5, not always for all the countries, and there's not always an overlap, but to have a good idea that these things blend together, and there's a reason why some of these things seem to work. Now, when we come to hips and knees, we have to look at some anatomy. This slide kind of sums up what the major parts of joints are. The cartilage, which is actually your spongy piece, hard slippery coating at the end of each bone. Cartilage breaks down and wears away in osteoarthritis. And joint capsules, tough membrane sac that encloses the joint. And then we have synovium, which is inside the thin membrane inside the joint capsule that secretes synovial fluid, one of the slipperiest types of substances known to man. Okay, it keeps it slippery, so especially over joints like your elbows and your knees. Synovial fluid lubricates the joint and keeps the joint smooth and healthy. Ligaments attach bone to bone. Muscles move the bone. And labrum fibrocartilage acts like a gasket, just kind of holds it and sucks it into place. Here's some pictures to help with some of our parts. One of the big ones, the anterior cruciate ligament, usually happens when somebody has their foot down, stationary in the ground, and they have a twisting action. Keeps your knee from shearing forward. Posterior keeps them from shearing backward. It's not as common. The side lateral collateral ligament on the outside, medial collateral ligament in the inside. And then you have attachments for your quad, which really goes right through the quadricep tendon, or the quadricep tendon into the kneecap, hamstrings on one side, and so on and so forth. Popliteous muscle is the one on the back. It's really a very important muscle. This is a muscle, and it keeps you from hyperextending the knee. And very important muscle. We'll also talk about some secondary causes. It's also associated strongly with gallbladder. Hamstring is always an interesting thing because a lot of people have hamstrings that are tight. The problem is sometimes it's not always the tight muscle is the problem. The tight muscle might be doing its job. It's the muscle is weak that's not holding and is actually not contracting as much as possible. So the hamstring has to take up the slack. And you find out sometimes that might be the majority of the problem. You get the other muscle to turn on, and all of a sudden, next thing you know, it actually the hamstring loosens up a little bit. Big muscles in the quads here, but the IT band plays a big part, and there's a lot of things that play on the IT band. Also, it connects into here called the fibular head. I find a lot of these things where parts of your foot, there's something called the cuboid bone that sometimes drops, puts pressure on the stabilization on the outside part of the ankle, which in turn puts problems on the IT band. And sometimes I see that more often than not. And with anatomy, we got to kind of look at the positional problems. And here's a backward tip pelvis. So the pelvis is actually rotating in this direction. And here's another one that's actually rotating in the forward direction. And what you see here is that this can also be caused by tight hamstrings going through here. Tight hamstrings going through here. And if I write that through here, and also it weakens the quads on the opposite side. This is actually finds a quadrant if it cuts right through the middle, where one side is tight or weak, I should say. In this case, weak here, and then it's tight over here, tight there. Now, in the other case, if we make that same type of triangle crossover, now you've got tightness here, weak on the other side. And it's really important to kind of make these things balance. This is one of the reasons why this happens. You can see that the femur kind of rotates in, and the tibia rotates also, and rotating the foot pronates. This is where flat feet can cause a problem in this kind of style here. And some more anatomy. Iliofemoral ligament. Ligaments connect bone to bone. Also, we have a synovial membrane here cut. That's where the synovial fluid gets produced from. Inside is the joint itself by itself. That's there. Major muscles, glute max, we'll go over this a little bit, but if this is not balanced or strong, then you're going to have an imbalanced pelvis, especially if it's on one side, create some problems. Here, the IT band, big band here. And again, if it's tight, is it because of tightness of just itself being tight, or is it because other muscles aren't doing their job? It's interesting when we talk about major things with alignment is because always look above and below the joint. And sports injuries, they talk about 80% of the injuries to the knee are related to the foot or hip problem because the knee is in the middle, but the hip's up here and then the foot's down here. And so any changes here is going to put angle changes on that knee. One of the big things I like to look at is gait, and again, that muscle we talked about, the glute max before, and it's very important for this knee, that leg to be able to be pulled back in extension to walk properly. And if this muscle is weak, then what happens, this side drops and the other side seems to be higher. And it causes a lot of distortion in the back, and you really kind of start with trying to get your pelvis corrected. Sometimes you have to go a little bit down to the foot stuff, but the pelvis plays a big part in maintaining our ability to walk. When we walk, our arms swing, our head moves, we actually spring back and forth from side to side. When we do that, we actually put like a baffle on our lungs. We're trying to move the lungs, make them work, and so it can breathe better. So it takes pressure off our internal organs. If you're walking and your arms are to your side and you get stiff like that, you can actually be losing a liter or two a day of air, which basically would be a good way to age you faster. Again, some biomechanics, as you can see. There's a Q line that's here. It's actually really different in points between males and females. Males have a tendency to have more of a straighter line. Females have a little bit farther line in, just because of the width of the birthing ability of the body here. But as you can see, this comes through and comes down. Again, if my foot rotates down, it's going to have forces to kind of rotate in, and it's going to rotate that in, and then it's going to cause all problems on the top of the pelvis and problems on the opposite side. There's been a lot of books on what happens with women, especially soccer, and that's going to be that age 18 to 22. It's not if it's going to happen, it's who it's going to happen to. 1 out of every 10 girls aged 18 to 22 will suffer a major knee injury. Again, the width changes that Q angle like we showed before. Again, some other hip biomechanics where you can see the normal shaft goes through and the point of rotation is through here, but now an excessive anteversion where it now pushes back a little farther here, and there's now an uneven pulling on through this area here. There's a retroversion that brings it back, and it gets more irritation through this way, and then there's an excessive anteversion with toeing in. So a lot of different variations. There could be some congenital variations to this too. With the foot, you technically have about 4 arches here. The transverse arches are really important, but because of shoes, sometimes as shoes kind of squeeze in the toe box, sometimes we don't have a chance to separate our toes. It doesn't build up the strength in our muscles or toes to maintain the arch sometimes. Longitudinal arch here. There's also on the opposite side, sometimes you find a cuboid bone dropping. When you find that, sometimes that weakens the outside part of the ankle, which is over here, which affects that IT band farther up. Pronation, okay, and then supination going down, so too much farther. This is pulling down this way. This one's dropping the other direction. Again, it's going to cause major problems up on the upper parts of the body. We saw the toeing in a little bit. What happened with the glute max? Sometimes that happens here, or a toe out. If they have too much tension in the glute max sometimes. Here's a normal walking, but you got a problem here, especially when the hip drops. On the counterbalance on the other side creates a problem. And so now you can start throwing out the other hip. Now the other one is genuvarum. You can see this is kind of starting to bow leg the knees out. The Q angle is a lot less than it is compared to here, compared to there. And the Q angle is even increased when now the knees are coming in more in this direction. And kind of knock knee, which is called valgum. The other one, which you see mostly a lot in women, is the popliteous muscle with hyperextension of the knee. So this gets too much positioning there, where it actually is normal. It's more of a neutral position. They're actually not coming out as far. So there's really 4 important parts. I mean, we showed you all the things that go wrong, but another thing to really look at, especially in combining the foot movement and the leg movement and the pelvis. Your great toe, your big toe, should get into ability to be able to extend. If it's not, it throws your body off. Ankle dorsiflexion, what they call a rocker motion. You should be able to have flexibility, not just 90 degrees, but beyond 90 degrees, bringing that foot up towards yourself. So you can actually good flexibility in the knee, which also makes you good swing ability. Hip extension, we talked about the glute max muscle. That muscle should be able to help you move back. If it's weak, it creates a problem. So you need to have good extension there. And counter movement of the sacrum and the pelvis on the opposite side. Those have to maintain. The glute medius actually holds you up, kind of holds up the other side as you go through. If it's not there, or the maximus also, it's not there, it creates a problem. Some factors in knee and hip injuries. Balance is always an issue. You can talk about things like polyneuropathies, and you have no feeling in your feet and things of that nature. The balance can be a problem there. Vestibular type problems in the ear canal, having some problems. And it's very easy to get an injury or fall because you're not getting input or proper input from all the faculties to help you keep balance. Gender plays a part. There are congenital defects, hips dysplasia, and things like that. Maybe just need to sometimes be assessed. Predisposed, what kind of past injuries did you have? Secondary causes, we'll go over secondary causes, but there's some other things. Are you more prone to inflammation? Do you have, let's say, a gallbladder issue or a small intestine or a large intestine issue? Every muscle in the body has an organ relationship, and it gets a kickback reflex, and sometimes reflex is not a favorable reflex. Okay. Protectionism, trying to protect something. Strength differences is because it's sedentary lifestyles. What's happening again at the above and your ankle. Did you have ankle problems? Okay. Did you have hip problems or pelvic problems in the past? Traumatic falls can do this. Repetition's another one. Prolonged postures. Hamstrings sometimes get tight on people just being sitting for long periods of time. And one of the things I like to do is there's a thing called the stick. Intracell is something that you can actually do a quick run out of your muscles or run down, kind of like a rolling pin action in less than roughly about a minute. And then, is there arthritis? Arthritis is an overuse. That's the big one that people have, or it's usually because of replacement. There's over 100 different types of arthritis, but the most common is osteo. And osteo is really kind of a misnomer because it really isn't a inflammatory disease primarily. It's actually just a wearing down after a period of time. Now, in that wearing down, if the tissues around them are getting caught up or getting hit by maybe bone spurs and things like that, it's a problem. Really, osteoarthritis is lack of motion. You start losing movement and you can't move and bend. And it's interesting that it's that flexibility plays such a big part as we get older, as well as strengthening. And then, of course, inflammatory arthritis is that actually is inflammations inside the joint, and that erodes away things too. And again, we're going to talk about arthritis here as we go through. And again, you can see some joint space here that seems to be decent. Synovium membrane and fluid in there, and the cartilage that's there. Cartilage that's eroded in the arthritis here. There's not a lot of spacing. That spacing creates lack of motion and movement. There's erosion in different areas, bone erosion that's especially around here from direct pressure. Now, bone erosion with something that's an inflammatory disease can be in other places besides where you would have the placement here. So the inside joint, every place around that joint can be affected by that. Common conditions, tendinitis. When a smooth muscle gliding motion on a tendon is impaired, the tendon will become inflamed and movement will become painful. When we're dealing with tendinitis, you're looking at the body's ability not to deal with the energy requirements, or the pulling mechanism gets beyond what the body's capable of doing. It can't disperse energy. And if your muscles are tired, if you're in the same position, you don't have a way to change positions or so on and so forth, and you do the same type of motion, and that muscle loses its ability to be flexible, and then it starts to actually, the energetics that are applied to it actually go into the muscle, and you have some other problems. Sprains and strains, an injury to a ligament, a tendon, or muscle when the force being applied to a tissue exceeds the capacity of that tissue to hold the joint stationary or stable. One of the big things too is notice, and they're putting pressure here on the knee, and where's the foot going? Usually it's when something's planted, you can strain something. It doesn't have to be always, but especially when you start seeing, meniscus type breaks and tears and things like that, it's usually what they call a closed chain. An open chain would be the leg would be out of the off the ground. Closed chain would be the leg is actually on the ground and pressure is being applied through it. Overuse injuries, otherwise known as cumulative trauma disorders, described as tissue damage results from repetitive band over a course of time. And you see a lot of these. The IT band is a possibility. You get hip joint problems on some people, especially like baseball players throwing downhill on that same leg. As a body ability to be able to take that damage or irritation. Bursitis that are here, and you can also have bursitis of the knee, but these are an inflammation of the fluid sac or the bursa due to excessive compression or friction. Labrums are a gasket and it kind of holds everything in, but they get a tear, especially if the knee is pushed or the legs pulled down this direction, gapping the outside part here. Can cause a tear that's on the upper portion, superior lateral side that happens there, and there's the tear here that happens. Meniscus tears, again, there's going to be basically the cartilage that tears here. This is usually what happens is kind of tears in the periphery. You got these pieces around here, which is your meniscus. Using a torquing action, usually then the leg is usually planted. There's really nasty knee injuries when you have something what they call the triad. The collateral ligaments on either side get affected, and then the cruciate ligaments inside get affected, and then also meniscus gets torn. What really works well here, at least from when we try to feel and try to do assessments on people, is also to have you walk. There's times I'll actually have it walk and actually take maybe even like a tongue depressor and put it between your teeth and see if you walk better, because there's some relationship with the jaw itself. But we also like to look at your foot patterns and how things hit. So this is a dynamic. This is both a standing static and a dynamic test to kind of see how your foot plants and do you do the things we talked about. You have heel strike. Does the foot go over mid stance well? Do you get good toe extension? And it measures the times that your toes hit, and are they late or early, and so forth, so on and so forth. Again, I want you to remember, toe extension is important. Ankle dorsiflexion is called rocker. Hip extension, getting the leg back. Counter movements of the sacrum and pelvis, and making sure if the pelvis is not level, you're not going to get good counter movements here. I'm going to come back to balance here, and it's called the central integrated state. It's our balance, and usually a lot of things we think are our balance is our eyes, and it depends on how the nervous system and your vestibular area, the fluid levels of your ears are working. Because if somebody is blind, they can stand upright, they can walk, they can even run or jog to some extent with some type of protection means to run into something. But some people don't have that. Sometimes the vestibular damage is bad, and as soon as they close their eyes, they're falling over. So we have the visual world, and conversion diversion is important for this. Ears have both acoustic aspect and vestibular. That's the fluid level in your ears. They give that. The spine is important because the spine itself gives input about where they are in space. And so does the various parts of muscle tissues here too. So the muscles, the spine, the ears, and the eyes are all involved in giving you proper balance. And so if you're getting hip injuries or knee injuries, you can get hip and knee injuries because you couldn't sense where you are, and you can twist and turn or fall over something and cause that problem. Now, another interesting technique to take a look at muscles is called Advanced Muscular Integrated Technique. There's a chiro that's actually kind of perfected this in a chiropractor in Utah, and he used to work with Utah Jazz several years back. And 22 to 24 years, he had half the injury rate. Well, he's got to be doing something. Well, what he was doing was he was making muscles, even a quad, which has 4 parts to it, has even additional parts. So he's multiple segments within the muscle. So he would treat that separately as actually almost being an individual muscle. And then a lot of these muscles will turn off due to compensation. So they would compensate, and then another muscle like the hamstring would get tight. And now people would maybe focus on the tightness of the hamstring. The thing is, you got to get these other, it might be taking up the slack for these other muscles that have been previously injured and turned off. Maybe in years in the making. And so when he was working on these guys, he'd be like, okay, I want to see take care of all the secondary things there. So when he did have an injury in front of him, it was just the injury, not something from an old lagging injury that came from high school, for example. Affects the proprioceptions, your sense of your body. And there's multiple things. There's up to 10 to 11 different things that can actually affect each segment of the muscle. And sometimes all those need to be addressed to get them together. Maybe just 1 or 2 things need to do. So again, multiple circuit breakers are involved to make these things work. So this is where muscular balance plays a big part. And the other thing is that, do you really need orthotics sometimes? If somebody has deformed tissue, let's say calcium deposits have arthritis starting setting, if somebody is diabetic, then sometimes orthotics are going to definitely be needed. But sometimes do they need to be needed? If you really work on even like things like hammertoes and things of that nature, is the muscle that actually pulls your foot into extension, not firing, or is the flexor working too hard? Generally, again, it would be the one that's actually the weakest is generally the problem. Not always, but generally. And so sometimes you can work somebody out from hammertoes. It depends on how long they've had it at that particular time. If they've had it for a long time and developed some arthritis in the joint space is compromised, then maybe orthotic is a possibility. All right, time to look at some chemistry. The chemical and inflammatory side. So these are things that sometimes we may not think about as a possibility of some of the problems that we're having with hips. We talked a lot about the structural side. But here's a real big one, and that one is going to be dehydration. And maybe your cartilage actually helps attract water to make the cushion. And so this impact is huge because, to give you an example, I was working with some higher end travel team that my son was playing with, and we had a day that we had 3 games on one particular day, and we had a triage set up in the hotel, so we were working on some of the kids, and of the 15 kids, 12 of them came in. Of the 12 kids, 9 of them, after we addressed their dehydration because of playing 2 other games, their aches and pains went away. And this will happen a lot in the office. I'll have somebody come in just to drinking their water increase, and all of a sudden they feel better because now they're not so dehydrated and they have more cushion in their joints and they feel better. So hydration plays a big part. Milk products and gluten products are big things because those can cause either an allergy or sensitivity. They can cause inflammation, excess water weight. The body will hold on to the excess water weight until you stop eating them. Okay, trans fats can cause inflammation, caffeine, smoking, alcohol, NSAIDs and other medications. And like Tom said on the talk, what happens is now that you've got taking NSAIDs, sometimes there's competition for certain nutrition into that joint, and over a period of time it can cause some problems. Red meat is also a co-inflammatory. It's definitely an inflammatory element. Sugars and artificial sweeteners play a part. Other things, if you're autoimmune, you better believe that you want to stay away from gluten and milk products. But that's what the body's just already prone to be inflamed. Anytime you bump something, that's going to come up. Leaky gut, 60 to 90% of your immune system's in your gut. Electrical magnetic fields can also cause inflammation. Adrenal fatigue, being stressed out. If you're stressed out, you don't have any buffer. So what happens is then when the body gets inflamed, the adrenal gland is supposed to be your fireman, can't do its work. Poor omega-3 ratios. This is a big one for the blue zones. We talked about people blue zones. The omega-3 ratios are really, really, really good. And that means they're anti-inflammatory, that they have a lot of them in their bodies, probably from the fish aspects. Overcooked foods, a big inflammatory too. Think of your deep fried foods and potato chips and things of that nature. Lack of sleep can cause inflammation. Your brain shrinks a little bit when you're sleeping at night, and basically what happens is there's these window cleaners that come in and kind of clean out your brain. If you don't get any deep enough sleep, you don't get there. Heavy metal exposures, big time. Depleted foods. Again, if you don't have the right foods to make things put together, the body has to compensate. Crop spraying, chemical problems, pollution runoff, dental amalgams. There's all kinds of problems with the mercury that has there. And if the body's acidic, it's in a state of breakdown. I don't want to get too crazy with the inflammatory pathway, but there's really kind of like omega-6 and omega-3 pathways. And omega-3 is easy because the omega-3 pathway comes down as anti-inflammatory in nature. It comes down this direction. And those are the better things to take a look at. Now, the omega-6 pathways comes down, and there's right here, and it's the gamma-linolenic acid area right here. If you start forming arachidonic acid, you're going to be a pro-inflammatory person. And if not, you're going to be anti-inflammatory. So sometimes these vegetable oils that we have, they're omega-6s, actually promote inflammatory states. So think about you're an athlete or you're just an average Joe, but you're always in a pro-inflammatory state, then it's a lot easier for you to get injured. It's a lot easier to maintain swelling and then harder for you to get rid of it, and it stays around longer. So understanding your chemistry plays a big part. There's a lot of things that you've seen. Glucosamine actually kind of attracts water to the tissue of the joint. Chondroitin is for chondrocytes that actually make cartilage. Hyaluronic acid, also in part of that. MSM, green lip muscle, manganese, vitamin C, tissue repair, vitamin E. These are all good things to help rebuild stuff. And basically, these are like minerals and things. We have some things that are anti-inflammatory. One is ginger is actually a good one. Turmeric is one of the better ones. Boswellia and resveratrol are similar. Omega-3s we already talked about. Arnica montana is a homeopathic, works really, really well for any type of bruising and strains. Works very, very well. It's not necessarily good for open wounds. And there's a couple different approaches when you're looking at knee and hips, and the allopathic approach. A lot of times, sometimes people don't spend enough time working and looking and solving the problem. I think you have to look, especially on the knee. We talked about you got to look at the lower and upper part of the body. Same thing with the hip. What kind of shoes you're wearing. A lot more history aspects here. Some of the treatment on the chemical treatment side. Anti-inflammatories. Well, pain does tell you something, but on the other side effects, it has gastrointestinal bleeding, liver damage, and some possibly bone losses. Muscle relaxers sometimes can also make you tired. Dependency, impaired cognition. If with those, bracing, sometimes needed, and sometimes we can do bracing, but if you do it for too long, it weakens the muscles that are involved. You got to get them involved. And bed rest, again, muscle atrophy and neurological regression. So those would be something to consider, especially in the allopathic approach. Now, we talked about body position and alignment, and maybe even scar tissue sometimes too. There's some techniques you can use to break down scar tissues. But let's take another view on some other things that you might not have heard about, like secondary causes. And there's built-in survival reflexes. There's a thing called ligament interlink. We'll get into that. TMJ. And it's amazing. I talked about before about using kind of like a tongue depressor, and then if you put it on one side and the other side, and all of a sudden I can feel I can walk better. It's because the head plays a major role in balance of the body, and the eyes have to be level to the horizon. We'll talk about that in a minute. Organ and muscle relationships. There's organ relationships, and not only does the organ relationship have a chemical relationship, it could also have an emotional relationship to what's going on with your body. The chemical relationship, a lot of times, the popliteous muscle, which we talked about before, keeps you from hyperextending, is associated with the gallbladder. And if the body has some gallbladder issues, I had a person, like I said on the radio, that had some problems with gallstones. It worked at a small point on his foot. He was walking with a cane. He didn't need the cane anymore. I mean, now that would probably eventually come back until you start addressing with the gallstone and addressing his dietary habits. But it's amazing how the chemistry can be reflective back to the organ system. As Tom was saying on the program, when you have a nerve coming out from the spine, at that particular segment, it splits into many branches, but it's still within the same family for where it came out of the spine. So one could refer to the other. So a problem in your popliteous muscle can show up in a reaction maybe in the gallbladder. The gallbladder reaction can show up in the muscle of the popliteous in the back of the knee. Acupuncture meridians, we'll talk about, does a river run through it? The meridians, if there's a line that goes right through that area, it's related to a meridian line or an acupuncture line that goes through there. You might consider that because that's running right through the area of concern. Inflammatory control, the adrenal response and inflammation, and making sure the adrenal response is doing well. The medical model sometimes doesn't look as sometimes in depth as you should to look at what happened in the adrenal glands and how the body is supposed to be taking care of inflammation. The ligament interlink, and it's an innate primitive reflex. And these are primitive reflexes that link the opposite limbs to each other. It's kind of like when you try to do a cross crawl. So your toes are related to your fingers on the opposite side, your ankle to the opposite wrist, the knees to the opposite elbow, the hips to the opposite shoulder. The SI joint, your SI joint to the opposite sternoclavicular joint. The xiphoid, that sees the xiphoid plexus, process with the coccyx on the back side. And you can see it's a cross-crawl patterning. And sometimes if you go to the cross-crawl point in the ligament at that point, if you rub it out, the pain on the opposite sides goes away. So sometimes you get these kind of strange interactions that happen, and it's called ligament interlink. Now, TMJ can play a part. That's temporal mandibular joint or disease, TMD, temporal mandibular disease or joint. You can have a distortion in the face. You can see that one eye might be out farther than the other one's farther. Nobody's really fully symmetrically perfect in their face, and sometimes there's more distortion that you can see there, and you start thinking there might be a TMJ problem. But also that also can work on distorting the pelvis too. Cervical cranial migration, mandibular shifting. Reduced reverse cervical lordosis, which means your neck is actually bending in the wrong direction, the opposite is causing an overbite. Or underbite, which is in the other direction. Postural changes over time can sometimes cause a short leg on the same side as the TMJ problem. Elevated shoulder and hip with the pelvic shifting. Remember we talked about how important the glute max is. And so if I have a glute problem, I usually a lot of times have a TMJ sometimes on the same side. You take care of the joint, the TMJ, and all of a sudden the hip gets better. You take care of the hip, and sometimes the joint gets better. So it's an interesting type thing. Bruxism and toe wear is important here, especially if you walk. If you're walking, and all of a sudden you keep on not going over a straight line, you keep on kind of going over center, so the median part of the body, you kind of stepping over. When I start seeing some of those things, like, I wonder if there's a TMJ associated with that, and the likelihood is high. This is something we work on in the office on, I'd say, at least for myself personally, about 4 or 5 times a day. Now, the reason why this is important, and again, you see that this is dropping down here, this drops down here, so this gets crunched down on this side, and this is getting gapped. Now, one of the important things is, and again, we talked about the adrenal glands before. And again, if I haven't taught you about before, the adrenals is a small little kind of like cap that sits on top of the kidneys. And the adrenals are responsible for flight or flight, survival mode. And your eyes have to be level with the horizon to be able to find your ways to run away. If your head's tipped to one side, the fluid level in your ears give you some very messed up information and might make you actually fall to the side or feel imbalanced. And so the body will do as much as it can to try to get the eyes level horizon, which means moving it through the jaw area or moving through the pelvis area or both. And I think one of the reasons why some people get scoliosis is because of what happens at the cranial system. Anyway, we're talking about organ relationships. Here's the organ relationships. So here's the spine here, and then these are all the organ relationships from the different areas of the spine that's related to them. But also L3 here, L4, those are ones that are going to be, if you take a look down at low back, pain in the legs, sometimes neurologically you don't have a good neurological connection to your knee or possibly your hip, and it might be turning the muscle on or off. That causes imbalances, so the nervous system has to be looked at too. This is a big thing on the chiropractic side of things. As a human being, as we take foods in, we have to put waste out. So if you take that to a smaller scale, every cell has to take oxygen and nutrition in, but it also has to take CO2 and garbage out. And how that gets that is through the lymphatic chain. You notice it's neurolymphatic, it's attached to the nervous system, and it's how your sewer system works. And each one of these muscles that they're related to here also relate to an organ system. And these spots are all spots that you can actually treat and make the fluids, or the muscle might feel heavy because the fluid's backed up into it. Okay? And if you don't have a good lymphatic clearing, then the muscle doesn't work. The muscle doesn't work, then you're going to be compromising joints. I know acupuncture for some people is kind of strange. You have these needles, you talk about energy that sometimes you can't really see it. But it's amazing how it works. It's been around for 5,000 years. One of the biggest things is the meridians, and does the meridian run through the area that you have pain? As you can notice here, we're talking about knees and things. We've got a gallbladder that runs through this area. We have a lung that runs through that area. To give an example, I think one of the best examples we had a patient that came in on their second toe, had pain shooting through the toe and went through multiple doctors, podiatrist, sports specialist, orthopedist, and they did x-rays, MRIs, didn't see anything. And one of the interesting things is that right through the second toe where it ends is a meridian. It's a stomach meridian. And treating it twice and the pain was gone. And now it also must possibly relates to the stomach and things like that, but we did the acupuncture points, treated the points that ran through it, and lo and behold, the pain was totally gone. So you got to look at multiple dynamics. The body is really a complicated piece, and there might be different ways to look at it or different other ways to take a look at to take care of particular type of problems. And just like every acupuncture or every muscle has a organ system, every organ system has a related acupuncture point, and every acupuncture point has an emotional aspects associated with it. And I think why those emotions would be something with hip and knees. Well, if I feel like I'm depressed, I can't get out, I can't do things, I become sedentary. And yeah, they're going to start having an effect on the movement of the body. So emotions are important. The adrenals are important because they're anti-inflammatory. So the inflammatory part and the ability to motivate yourself to go out and do things is extremely important. And one of the things about meridians, here's a myofascial or the connective tissue aspect for the leg, and then you look at the meridian for the kidney. And then sometimes these can overlap almost exactly. So again, treating the kidney for a myofascial area might be beneficial to hit it from as many different ways you possibly can. And this slide is pretty much straight up on what we're talking about. Kinesio taping is something that you can actually help the muscle function move. You're not really taping the joint, though. In some cases, you do. Majority of this is actually taping the muscle. And the taping method is applied over the muscle to reduce pain and inflammation, relax overused tired muscles, and support muscles in the movement on a 24-hour daily basis. It's like a 24-hour therapy. And what you do is you put the muscle in stretch, and then you apply this tape. So then what happens in stretch, when you contract it, actually helps you contract the muscle. It is non-restrictive. It's a type of taping which allows for full range of motion, which is good. It also can be used for any type of bruising or lymphatics that's not moving. If swelling in an area, helps pull the swelling and draw it to where it needs to move to. And now a little bit more about stress. Stress can have such a profound physiological effect on the body that it may interfere with the body's ability to recover and repair itself. In other words, chronic mental stress may actually lead to physical overload. You can be stressed out and tighten up muscles. You can be stressed out and actually the chemical pro-inflammatory things that happen in your body might be used up. Research that indicates that stress impairs recovery. Even after adjusting for fitness workloads and training experiences, both perceived stress and life event stresses impaired muscular force and perceived energy. In addition, was also associated with more fatigue and soreness. Recovery was improved and faster in participants with lower stress. Some anti-stress ideas, cognitive behavioral exercises include Tai Chi, yoga. One of the things on this is you're breathing, you're moving, and you're focused. And that's one of the key things there. Because right now, what's after that? Breathing, meditation, kind of focusing, relaxing the body. Good humor always fights, good laugh always fights stress. And time management. And here's an interesting one. It's kind of wacky, but it's a really, really good and extremely gentle technique. It's called IRT, Injury Recall Technique, and it's following a recent or even ancient injury or trauma. The body is just trying to protect itself. It stores the memory of your irritation. Some people have a hard time getting back in a car after a car accident. Or let's say you touch a burner and you go by the burner, you're automatically tracked in your hand because the body remembers it. And there's ways to bring it out, and there's ways to get rid of it. There's a certain technique that's done with it. And it's very, very easy, very gentle motions. And sometimes that could be actually holding on to the pain, because the body's thinking it's a preservation type matter. And I see this probably on a weekly basis. Another device that we have in the office is the extracorporeal Shockwave Therapy, ESWT. Use Shockwave Therapy to actually work on arthritic joints, compromised joints, scar tissue, and things of that nature. It's effectively used to treat musculoskeletal conditions, complaints involving attachment points for tendons and ligaments in the major joints, such as plantar fasciitis, Achilles tendon, shoulder, elbow, knee, are common areas for ESWT treatment. The treatment's about 10 to 15 minutes long, usually needs about 2 treatments, maybe twice a week or maybe once a week over a 5 or 10 week period, about 10 treatments. In the months following ESWT, the body's healing response kicks into gear, which results in new healthy tissue and blood tissue vessels to replace the injured and damaged tissue. So what it does is actually create an acute type of reaction in the body. When the body heals as fast as when it first heals, so it actually stimulates a little bit of the stem cells part of the body. ESWT treatments are usually performed in a doctor's office and are considered an outpatient procedure with a quick recovery. There really doesn't have much recovery time that's needed. It's pretty safe, and it's something that we've been seeing, starting to work with. It's new in our office and starting to see good results. Now, on the medication sides, we run into some problems. And again, opioids, there's a lot of things with opioid addictions. You know, of all the common causes of side effects, include a lot of things like vomiting, drowsiness, itchy, dry mouth, dizziness, constipation, strong possibility of addictions if you don't control it. It can be a major downfall for some people. And again, you know, drugs have side effects. I love this one. It says drugs need drugs, like opioid-induced constipation. 40% of myositis patients live with pain. Opioids causing constipation, learn ways to help they alleviate the constipation. So now you have another drug for that, and maybe another drug for that. And again, some more information on NSAIDs, which are non-steroidal anti-inflammatory drugs. Nausea, vomiting, diarrhea, constipation, decreased appetite, rashes, dizziness, headaches, drowsiness, increased heart attacks, 25% hearing loss, 40 to 60% cardiovascular problems, 7,000 hospital stays, especially the GI, 80% increase in miscarriages, 10 to 30 increase in allergic reactions, because what happens also has an effect because of the digestive system. NSAIDs also deplete glutathione, which is your major antioxidant of the liver. Kidney can be damaged from taking both NSAIDs and acetaminophen together. So what are your options? Well, one of the medical side is, okay, we can drug medication. I think the thing is go to the cause and try to look at some of the other things we suggested. But the other option that they have is surgery. Surgery options for those dealing with painful knees range from arthroscopic knee surgery to total knee joint replacement. Research has shown that some of the most popular arthroscopic surgeries have no benefit at all, including meniscus surgeries. Knee replacement is extremely traumatic and carries newfound risks of toxic wear particles entering the bloodstream. There's also blood clots that can also be associated with that. Surgical risks aside, all surgeries normally require months of painful rehab to regain strength and mobility. Most surgeries also accelerate the cascade of degenerate that leads to osteoarthritis. You know, you think you're going to get your full range of motion back in your knee, and it's not necessarily going to happen. You know, it's in cases it does take the pain away, but I mean, there does comes with risk, and you do have to do the exercise. If you don't do the exercises, and especially on these situations too, you might end up being in a wheelchair. In a 2008 study, a Canadian study compared the benefits of physical and medical therapy to arthroscopic surgery for osteoarthritis of the knee. Researchers concluded that physical and medical therapies provided equal benefit to surgery. In 2013, researchers compared the functional outcomes of physical therapy versus arthroscopic for patients with meniscal tears. They found that arthroscopic followed by postoperative physical therapy had no benefit over the physical therapy by itself. So some of the problems with knee replacements, increased heart attack rates, bleeding ulcers, 6 times for hips, 3 times for knee. Metal ions in the body, size corresponds to the amount, higher levels of cobalt and chromium, titanium. Levels of activity lower than expected following knee or hip replacement. Severe persistent pain despite total knee or hip replacement. Scar tissue can play a part in here. Allergies to metals. Knee replacement prices soar as outcomes drop and complications mount. Perishing from a hip replacement are 3 times higher for patients age 80 and over. Again, clots are problem, infections. Heavy patients can also do poorly after hip or knee replacement. And smoking is another. And we have new advances in medical. We have the human allographic cells and platelet-rich plasma procedures are the world's most kind of advanced regenerative injection treatments for treating knees, pain due to arthritis, meniscus tears, and traumatic injuries, overuse conditions, other genetic conditions. Also, can't forget the hips too. Traditional options for patients suffering from these include arthroscopic knee surgeries to repair interlink ligaments, total knee joint replacements. With both surgeries, months of rehab are required to regain the strength and mobility of the patient and must be aware of and prepared for the associated risks. And there's some new things in regenerative medications, and I'm not going to talk much on stem cells because now the FDA has come down on stem cells. There's some other things that are similar to it that I'll touch on, but the stem cells are going to be are being taken away for the time being. So what I'm going to do is talk more like blood platelet treatments, PRP, and the platelet lysate injection treatments contain healing growth components from your own body that increase your body's natural ability to repair itself. The use of PRP to repair joints, tendons, ligaments, and muscle injuries is becoming well known thanks to exposure from professional athletes. Platelet injection treatments are effective because they have a stimulating effect on the stem cells within the targeted area, but these are not stem cells themselves, making those stem cells work harder and then to heal damaged tissues. Platelet procedures are commonly used for soft tissue injuries, mild arthritis, and spine conditions. What's interesting is a lot of times we get a lot of the information that we have on these type of things by looking at horses, because people are huge in the horse racing business. There's millions of dollars at stake, and so they're always looking at new therapies, and they find that these work without a lot of side effects. They're like, maybe they have something to do with other. You can do it for other animals, or we can actually take it farther and go into human studies with it. Prolotherapy is another technique used to treat back injuries and chronic pain. It involves injecting a dextrose solution into place where the soft tissue is injured, such as a joint, muscle, tendon, or ligament. During prolotherapy treatment, the injection is usually paired with a local anesthetic, such as procaine or lidocaine. The solution can be sodium morate, sugar, or a mixture of sugar and phenol. A series of injections are given, usually 3 to 30. Depending on the condition of the injured area, it may take 3 to 6 months for a person to complete the injections. So, and prolotherapy is another one. It probably can cause 30 to 40% acceleration and recovery of acute ligament injuries. It did not find prolotherapy to have significant effects on the strength or the laxity of joints. But he also doesn't, so Meekin comments, though, that he does not believe in the prolotherapy's effects on other types of injuries, specifically injuries to the lower back, facet joint, or pubic symphysis. And there's been some linking of prolotherapy to allergic reactions and nerve damage, but these findings were not severe and they were not classified as severe. Also, long-term use of prolotherapy can actually maybe cause a weakening of the joints. So prolotherapy and plasma work and allographic cell tissue, which is really going to be kind of in replacing a stem cell. The problems with some of these is most health insurance policies do not currently cover prolotherapy. Payments expected at the time of visit. It costs to be $150 to $400 for the treatments. Plasma and human allographic cell tissue can be up to thousands, even higher. So in conclusion, we have our own standbys. We have our exercises that we need to do, range of motion type things there, applying heat, moving the whole joint. So here's what you need to do. First off, you got to take a thorough history. And you really got to, thorough history means like what kind of shoes you using, what kind of sports you playing, what kind of sports that makes you feel like you have the injury. Do you have problems going upstairs and downstairs? Do you have problems first thing in the morning? Do you have problems laying on your side? Does the pain, it might not even be the area of complaint. Like a hip problem could be actually I can bring the leg up, but I can't get my foot into my pants. I'm struggling. I feel pain coming down through my thigh into my shin. Still could be a hip problem. Check the functional alignment from toe to head. How is your jaw? How is your head position? How does that look? You know, how's your foot? Do you have good heel strike and mid stance and toe off and dorsiflexion of the foot? And how's the movement of your pelvis? How's that extension of your glutes themselves? All those play a major part. Orthopedic and neurological testing. Put the joint in a particular position and shear it and see what happens. Neurologically, is there any type of loss of nerve function or vibration or light touch? Gait scan, important too, and observation of the gait scan. Or not the observation of gait, but observation of your walking. Take a tongue depressor, take it on either side of your jaw, and then see if sometimes when you put it in there, all of a sudden you find that I'm walking better if I support one part of my jaw or the other. Apply kinesiology. Find the muscles that are weak. Find the muscles that are imbalanced. And apply kinesiology also, you can actually refer possibly being something from an organ system that might be relating to it. That's how we find it, is usually apply kinesiology. Let's look at your scar tissues. Find out there's scar techniques that can be done in combination with applied kinesiology. I had a particular patient that killing hip pain, bilateral hip surgeries because he was a dancer for 20 years, and just doing the treatment on the scar itself relieved 95% of his pain in one visit. Advanced muscle testing is using the AMIT work and taking a muscle and break it down even farther. It might be a minute difference in the way they angle the body that makes a problem. So the AMIT works really well. Do we have to do some imaging? Do we have to take a look at the arthritis? Do you have bone spurs and things in there? Is there a joint mass or something like that? Blood work. What's the chemistry doing? What's the inflammation doing in the body? And that's going to be something that's going to give us some insights in the organ function, and also in regards to maybe a physical stress that you have a lot of inflammation. Spit tests really test the adrenals. EMI is actually checking the acupuncture meridians, or are they strong, and checking the acupuncture meridians, and does the river run through it type ideas. Evaluate your diet. Are you eating something that might be causing an inflammation to your system? When we do all that, we want to turn on the muscles. We want to get the alignment taken care of. We want to treat maybe any old weird patterns the body's trying to guard itself about. We want to reduce and mobilize scar tissue. We want to control inflammation. Control all the 5 factors of your balance, because if you're not balancing, you fall over and you hurt your leg and hip. There's a problem there. Do you do the appropriate exercise? Do you need kinesio tape for supporting? It helps you continue moving without necessarily fully bracing you. Cold laser and other modalities. There's sometimes ultrasound. You need to break some tissues up. Deep tissue massage, some sports massages and those kind of things. Cold laser actually accelerates healing. It actually accelerates healing by 30 to 40%. Consider a co-treatment with a medical model. Maybe you might have to get the knee replacement. Maybe you might have to get hips. Well, what's the best way to make sure that everything else is working? Was working with somebody with the thought process that we have. The interlink, the ligament interlink, does that play a part? We need to go back to the spine and look at the spine that innervates that part. What's the lymphatics for the part? Lots of things to do. And finally, our gift to you. For tonight, come and be able to listen tonight, and if you want to take advantage of this, we usually run an examination, and it's a 2-day event for $225. We're actually doing this for $99. And we're actually not collecting money for us. We're actually collecting for a group called Caring for Others, a 501c3 charity, where we'll donate monies to help with the food banks, help with treatment for people who don't have the money to be able to afford care, also help people with grants to actually want to further their studies if they want to be interested in this kind of work. So what you get for instead of $225, we charge you $99. What you'll get is on the first day, we'll ask you to, and if you can, bring your x-rays and your blood work. We'll go through the full evaluation, a thorough history, try to look at what your blood works are doing, the Gait scan, an EMI, evaluation for the AMIT work, through the applied kinesiology work. All those will be done. That's included into your program. The second day you come back, we kind of talk about that. If we have to order x-rays, we'll talk about the x-rays. Do we have any problems in those kind of elements? Do we have to do, what's the structure, chemistry, emotional parts that we need to do to take care of? We can do all that. Now, where does the money go? The $99 actually goes to a 501c3 charity that actually helps the food bank, helps with people who can't take care of themselves. So they don't have, or not take care of themselves necessarily, but don't have the money to afford it. Also, there's people that are interested in doing this kind of work. We like to give grants and scholarships to them, and it comes from this. So we don't collect any money from this, and this is also a tax write-off for you. So if you can, let me help you. And thank you for taking your time. God bless, and have a good night.